हेलो हाय आदाब और सत श्री अकाल। एक बार फिर से आ गया हूं मैं आप लोगों के बीच, आपका हमराज आरजे अभिनव 90.4 मेगाहर्ट्ज कम्युनिटी रेडियो ज्ञानवाणी यानी कि ज्ञान की वाणी पर। और आज लेकर आया हूं आप लोगों के पास नो योर फैकल्टी में एक और फैकल्टी जो कि हैं अलाइड हेल्थ साइंस से। उनसे हम कुछ सवालात करेंगे, सर के बारे में जानेंगे और सर से उनकी फील्ड के बारे में ज़्यादा बातचीत करेंगे आज, जिनका नाम है डॉक्टर प्रसाद कुलकर्णी, जो एसोसिएट प्रोफेसर हैं ट्रांसफ्यूजन मेडिसिन DIYP इम्यूनो हेमाटोलॉजी डिपार्टमेंट और MD पैथोलॉजी FR LTMMC साइंस से उन्होंने किया है। He has worked at J.J.H हॉस्पिटल for over 8 years. Now here for at least 4 years और इस वक्त वो हैं यहाँ पर अलाइड हेल्थ साइंसेज से। तो सर से कुछ सवालात करते हैं, उनका वार्म वेलकम करते हैं और शुरुआत करते हैं सवालों का सिलसिला। सर कैसे हैं आप? हाउ आर यू?
आई एम फाइन, थैंक यू फॉर इंट्रोड्यूसिंग मी, इट्स काइंड वर्ड्स।
वेरी वार्म वेलकम सर। सर आपकी फील्ड से कुछ सवालात करता हूँ which is very important, especially how can effective communication and empathy contribute to positive patient outcomes in allied health professionals?
It's a good and a basic question for everybody. Communication is an integral part in patient healthcare, and it's true for all professions. It requires in hospital, as in a situation with patient relatives as well as team members, authorities. While communicating with all these, you should have proper communication skill. With effective communication, you can ensure trust and empathy towards each other. Patient know you, and even your team members trust you while what you are working.
Okay, my second question. Explain the importance of interdisciplinary collaboration in allied health settings. Provide examples of how different healthcare professionals can work together to improve patient care.
We have different allied healthcare specialties. Starts from anesthesia, transfusion medicine, as well as diagnostic areas. In hospital scenario, there are different specialties taking care of patients simultaneously. Amongst different specialties, you can refer patients to each other, and different a single patient is taken care by multiple departments simultaneously. For example, a patient requires some operation, then first visits to surgeon, and he will be examined by surgeon, and then he asks some more diagnostic tests. That patient will be referred to again radiology, pathology. In that area, if you get some diagnosis or any more information, then doctors can operate them for further procedure. Then he will be posted for in a operation in a hospital setup. At that time, he will be taken care by anesthesia department for a pre-anesthetic checkup.
Okay.
And can be counselor come there to counsel about investigation as well as operative procedures. On the day of operation, he will be taken care by anesthesia department, various staff nurse, and all these are allied professions. And after that, post operative care like physiotherapy, occupational therapy, nutritional, and sometimes psychotherapy is required. All these are allied professions. So they look after the patient in holistic approach.
Yes, great. How have recent technological advancement impacted allied health professions? Discuss specific technologies and their implications for patient diagnosis, treatment, and overall healthcare delivery.
Nowadays, technology is in hand with all medical field.
Yes.
Innovations on the
they are actually going on daily.
So every specialty is supported by technology, but it should be in skilled hands.
Yes.
I stress on skilled hands because only machine is not important, but skill entity, individual behind that machine is important. And if you give that machine to untrained person, again it will be danger for the patient as well as all the setups, resources will be waste. Nowadays, I am a pathologist, so from initial days we read all CBC parameters, but nowadays there are innovations, cell counters. First came 3-part, only differential. There are technical. These are technical terms. Students may are oriented with this. But nowadays 5-part, 6-part. Any further scope is there for any research, and all together they are giving more information. Nowadays AI, artificial intelligence is there. But again, I stress on individual, those are skilled in it, have orientation, and they are ready to operate this technology. So technology as well as training, both are crucial in innovation as well as implementation of innovation in healthcare.
Okay. Why is cultural competence important in allied health professions, and how can healthcare providers ensure they provide equitable and sensitive care to individuals from diverse backgrounds?
We call India as a diversity in
Yes,
unity.
diversity in unity, yes.
So thing is that we have different backgrounds, or some patients of different religions. They have their own customs. They have their own routine. So while communicating with patients, we should take this, consider some community have fast in different months or that. While taking consideration of his appointments and all that, if we take consideration of these things of cultural beliefs, and we everybody is have proud of their own customs and beliefs. So we have to take consideration of these things while communicating with patients also.
Okay.
So this is important for the good patient relationship.
Okay. How can practitioners integrate the latest research findings into their clinical decision-making process, and why is this approach crucial for improving patient outcomes? And that is the last question, sir. Okay.
So the thing is that latest research is not only on the paper or not only the labs. It should be beneficial for the humankind, mankind. So anything that is beneficial for the patient will come for the patient care, and it will be implemented by medical professionals.
Okay. Sir, एक और क्वेश्चन आपसे पूछता हूँ. What are some common ethical dilemmas faced by allied health professionals, and how should they navigate these situations while ensuring patient welfare and upholding professional integrity?
So ethical dilemma is every allied health profession has a specific orientation to that subject. That means he has a qualification, he has a training of that specific, considering a pathology lab technician. He can be assistant with pathologist or taking part of diagnostic workup, but he cannot be replacement for radiology technician.
Oh yes, oh yes.
That means he should be knowing his own strengths as well as his limitations.
Limitations, yes.
There are high chances people will force him to do
Also other stuffs.
But at that time he should be firm and ethical enough. I will not do this because this is not my domain.
That's not my work actually. This is not my domain especially. Yes.
This is the main, and they can be sure about the patient care in that field where they are trained.
ओ ग्रेट. आज प्रसाद कुलकर्णी सर थे हमारे साथ. उन्होंने काफ़ी ज़्यादा हमें अच्छे से बातें बताई और बहुत सारे सवालों के जवाब दिए, जो कि स्पेशली काफ़ी ज़्यादा स्टूडेंट्स को हेल्प करने वाले हैं जो कि अलाइड हेल्थ साइंसेस के सेक्टर्स में हैं और इस एरिया में, इस फील्ड में काम कर रहे हैं. थैंक यू वेरी मच सर कि आप यहाँ पर आए, आपने हमें कई सारी बात बताई. थैंक यू. बने रहिए हम लोगों के साथ 90.4 मेगाहर्ट्ज़ कम्युनिटी रेडियो पर. थैंक यू सो मच.